Okay, so for IV push medications, you would have to gather your supplies. Before going into the room, you would get a syringe for the Reglan, the MAR, some stickers to put around the needle, and then also a drug book. So the patient is going to be ordered the Reglan for her pain and nausea as needed. So what you would do is you would have 2 wipes, and then you would clean the top of the medicine for 15 seconds and then let it sit for until it's dry. And then what you would do is you would get the medication out of the vial. You would pull back the amount of medication you need in air, take it, put it in the vial, push the air, and then pull out the medication to whatever amount you need. And then you would take this out and then safely put the cap back on. And then you would go ahead and label that medication. So the medication, you would put the date, what medication it is, and where it's going to be given. And also you would calculate the rate you would infuse the medication and what medication and what saline solution can be administered with the medication. So after you label the medication, and you would have to do a calculation about how fast you would administer the medication. So for Reglan, it's 1 to 2 minutes, over 1 to 2 minutes. So, and then you would count how many lines. So with the Reglan medication, it goes up to about 10 lines. So you would divide you would divide 60 seconds divided by the 10 lines. It would be 6 seconds per line. And then over 2 minutes, it's 120 seconds divided by 10. So that'd be 12 seconds per line. So we're gonna do it over a minute. So you would then gather your supplies, take it to the room. You would take 2 wipes to clean off the port. And then you would wash your hands, verify the patient's name, date of birth, and any allergies, and verify it against their wristband. And then you would check the site to make sure there's no infiltration, phlebitis, or any infection going on, or if there's any pain complained of by the patient. And if everything seems fine, you can go ahead and wipe off the port of the IV, 15 seconds, and then let it sit. And then you would take the first saline solution that's compatible with the medication, and then you would stick it and then infuse it, and make sure to ask if there's any pain with the infusion. All right, and then you would take the Reglan, put it in the port, and then each line is 6 seconds, so you would do that, 6 seconds per line. And once that's done, you would go ahead and infuse the normal saline, the second vial of normal saline, over 6 seconds like you did with the medication. Right, and then that would be done. Now if they have a running IV, you would use the first port on the IV line, and then you would do the same thing. You would clean the port, 15 seconds, administer the first amount of normal saline, the Reglan, over 6 seconds per line, and then the normal saline, 6 seconds per line like you did with the Reglan. And then you would go ahead and wash your hands, make sure the patient's comfortable, bed lowest position, side rails up, call light within reach, and then make sure that he isn't complaining of any pain when being given the medications. And then you will record what you did in the room.